that we are indeed recording this webinar. And I think we will kick off. So good afternoon, colleagues. My name is Kira Fortune. I am the Senior Technical Advisor for Healthy Aging and Healthy Settings at the WHO Euro Office in Venice. And I have the grand pleasure of co-moderating today's webinar together with my wonderful colleague, Ardiana. So on that note, let me kick off with just a few opening remarks, because it's a real pleasure to see so many colleagues connected and joining us for today's webinar, which is Building Thriving, Equitable Regional Health Economics in Practice. And of course, we would like to extend a very warm welcome to all of you. So I think today's event is a really wonderful example of partnership in action, really bringing together the WHO Regions for Health Network, the South West Wales Regional Health Economy Group, and our colleagues at the WHO Collaborating Centre on Investment for Health and Wellbeing in Public Health Wales. And I would like to thank all of you for putting today's webinar together. So let me also share that this is not a standalone event. It's rather a part of an ongoing conversation that has been evolving across the Region for Health Network over the last few years, and one that really truly reflects a growing recognition that health is not simply the outcome of healthcare systems, but also of the economic, social, and environmental choices that we make every day. Our journey began by asking a very simple question: what does a well-being economy actually mean for regional governments? And in 2023, we explored this through our very first dedicated webinar, looking at how regions can align economic development with better health, greater equity, and long-term sustainability. And since then, the conversation has truly evolved. And at our annual meeting in Trieste, and later in Norway, Austria, we moved from concepts to practice. Regions shared inspiring examples of how they're putting these ideas into action, and whether it's through community participation, prevention, stronger integration between health and social care, housing, policies that promote fair and inclusive economic development. And what has been particularly encouraging is that these examples have really demonstrated that a well-being economy is not an abstract aspiration. It's rather taking shape in regions across Europe with very practical solutions that really improve people's lives, whilst also strengthening resilience and sustainability. Now, alongside these discussions, we've also established that the Regional Health Networking Group on a Wellbeing Economy, and this, of course, also provides a very practical and important platform for regions to learn from one another, exchange practical experiences, and also adapt successful approaches to their own local context. And as always, within the Regions for Health Networks, our greatest strength, of course, lies in learning from one another. So today's webinar really represents the next step in our shared journey. Across Europe, regions are facing many of the same challenges, from widening inequalities and demographic change to financial pressures and to that of climate change. At the same time, they're also developing innovative responses that demonstrate how investing in health and well-being can really generate social, economic, and environmental value. So this afternoon is really our opportunity to hear some of those experiences, to reflect on what works in practice, and most importantly, also to consider how these ideas can be adapted and scaled across different regional contexts. So I would like to thank all of you for joining us, for the exceptional speakers that are joining us here today, who are taking the time to share their experiences. And it is also my great pleasure to now introduce my colleagues who have been instrumental in putting this webinar together. My colleagues will also be sharing a few opening remarks, but also really setting the scene. And with that, I'm going to hand over to Ardiana who's the Technical Director of the WHO Collaborating Centre on Investment for Health and Wellbeing, to introduce our next speakers. So Ardiana, the floor is yours. Over to you.
Thank you so much, Kira, and really great to see so many colleagues and participants from various regions and cities joining as well. Delighted to be part of the webinar and bringing it together with Kira, Visa, and colleagues. Thank you so much for your support with doing this, as well as colleagues from the Southwest Wales Regional Health Economy, and we'll hear more about that a bit later. So as Kira mentioned, we have been working together. So I believe our collaborating centre as part of Public Health Wales has been the linking sort of the link between the international agenda, the work WHO, Regional Office for Europe, and the Office for Investment for Health and Development in Venice, Italy, has been doing in terms of health and well-being economy. Welsh Government colleagues, who I'll introduce, and they'll have some greeting and introductory remarks as well, and then seeing really how this learning, how this networking, exchange of experience, expertise, best practices can be translated into the Welsh context, particularly through, example of the Southwest Wales Regional Health Economy, but also the other way around, how we can export what we do in Wales and then share with the rest of the network. So I'm not going to speak too much. I just, again, we have been really privileged over the last so we have been a collaborating centre for 8 years, but this agenda has really come strong, particularly in relation to COVID or post-COVID, with the changes in socio-economic determinants of health. We've just been in a conversation actually looking into some data in relation to that. It's really interesting to see some of the reversing trends in terms of, for example, healthy life expectancy and so on. So the important role which what we're talking about, economy, society, environment have on the experience people have on their health and well-being objectively, but also their experience subjectively as well. So as a collaborating center, particularly as part of the Wellbeing Economics and Value team, we're looking into some of this work, some of the health equity work, which the Venice office is progressing, and seeing again where could be the learning and how we can translate this in the Welsh context and vice versa, Wales into the international context. So I would like, I'm very pleased. I know that we have a few colleagues from Welsh Government joining this webinar as well, but I'm pleased to introduce Rodri Wyn-Jones from Welsh Government, who will also provide some opening remarks. Rodri, it's over to you.
Thanks very much, Mariana, and Prynhawn da pawb. Good afternoon, everyone. It's really good to see some familiar faces on the screen, actually. I know a number of you, but for those who don't know me, as Mariana said, I'm Rodri Jones, and I work in the Public Health Directorate of the Healthcare and Prevention Group in Welsh Government. So great to meet you all. And a focus of my role is on supporting our international activity in the public health space, including through our work with European networks, such as the RHN, and with Public Health Wales colleagues as well, to support our strong strategic relationships with WHO Europe and other key partners. So it's really great from our perspective to see this webinar happening today. Sessions like this are a really great opportunity to share examples of work that's happening in different regions and experiences across areas of common policy interest for regions across Europe. From a wider Welsh Government perspective, it's also an exciting time for this agenda. We're in the very early months of a new government, which has made clear it's very keen on international learning and collaboration. And also for the first time, we have a minister with specific responsibility for preventative health and setting that as a clear strategic priority and a shared focus across government. Our continuing focus on health equity in particular and its links to the wellbeing economy plays really well into that space. And as has been mentioned, we're working with colleagues in Public Health Wales and WHO Europe to plan the activity under this year's special initiative on the wellbeing economy. And we'll also be working to align that work to the emerging priorities of the new government as they continue to take shape over the months ahead as well. So yeah, really look forward to hearing this afternoon's case studies and to continuing to collaborate and learn from each other through this network and through other opportunities in the months ahead. Diolch yn fawr. Thanks.
Diolch yn fawr, Rodri. Thank you so much. And I would like then to introduce Dr. Ardiana Gjini, who is our Executive Director of Public Health of one of our regional health boards, or sub-regional. It's interesting because, of course, we are, we call them regions as part of Wales. So it's Hywel is the health board. So please, over to you, Ardiana.
Great, thank you very much for that, Mariana. Good afternoon, colleagues. Really good to be in this forum. Really looking forward to hearing and learning from the case studies that you all have to share. So, as Mariana said, I'm one of the executive directors and I have a public health portfolio in the health board, and I'll just very briefly give the context of what that means. Hywel University Health Board. Hywel was the king of this area, so that is the name that the health board bears with itself. It covers a very big geography. Hywel as an integrated health board, more than a third of the whole territory of Wales, but from a population side, it is a rural area, so slightly smaller population. We cover just under 400,000 people. The regional economy work we're doing, that's in the title, the region. It means that it incorporates another autonomous health board, which is here we've got, and that's what I'll be talking about. The example, it's the Swansea Bay University Health Board, which in geography it's much smaller because it's got some really big urban areas, cities, but with population is just slightly bigger. So as a regional area, we are working strategically, coming as two independent public bodies for NHS, so health boards, to see where we can find synergies in working more strategically for the West Wales, the beautiful West Wales. If you haven't been around for any holidays or travel, I warmly invite you to see how we can strategically make more efficiencies and more meaningful work areas, as we cover just under a quarter of population of Wales, about 25%, and we've got huge big areas that both the population attends each other's services, but also our staff are shared. So that's one of the missions, is to make planning, commissioning, provision of the health services, which encapsulates not just the healthcare service, but also the broader, as I'll be talking about, the public health services. The well-being economy is one of the work streams of the whole regional approach, the regional joint committee. Caroline, shall I share these slides myself? Would that be all right? Or were you intending to?
Sorry, no, I'm ready.
Okay, so yeah, we can start from.
I think it's an easy, thank you, Ardiana, because we'll transition directly to the presentations. I think that will be best as you're talking already. So
yeah, Caroline has got the slides, so we'll share. Thanks, Mariana. So on the people, place, procurement partnership. So that's where I was starting. So our framework is that we're working on the framework of 4 Ps. So focusing on the people, we are the biggest employers in the whole region, both university health boards. As Hywel and Swansea Bay, we employ just under 30,000 people together, but also people as in our residents, and working in partnership. Then the next P is with our other public services, but not only public services, with voluntary sector and in a slower but a really clear way, engaging also with our independent sector. And then the other P is the place. So we're really looking at what makes, as earlier we were talking about, what makes our people healthy or not healthy. So one of the focuses of our current work stream as a well-being economy is on warm homes. So trying to find all the incentives and all the mechanisms that we can improve housing as one of the determinants of public health. And then also working with departments in the local authorities around the planning. So making our planning of our towns, roads, premises in a way that it will support rather than diminish public health. And the fourth P is the procurement, the money, the public purse. How do we make the money that we spend, which is, again, the biggest amount of money that is spent in the region, over £2 billion that are spent every year. How do we make that money through all the procurement, but also other mechanisms to work towards facilitating a well-being economy? The next slide, it gives a bit of a description of what the population of Southwest Wales is. So the region, as you can see, as I said, it is fairly rural, largely in terms of geography, the area is Hywel and beautiful coastal. Just under 800,000 people, but some of the key determining factors are the poverty. You'll see about 25% of people will live in some form of poverty, whereas over every third child in the area lives in poverty. We've got a very high rate of people that are disabled, and then very high rate, just under 50% of people, 46% of people that are economically inactive, so not necessarily unemployed, but economically inactive. And as we know, being economically inactive, not having a purpose, not only that directly affects from the wealth perspective, the public health, but it affects from much broader perspective, people's social isolation, sense of community belonging, etc. So we're trying to work in that context and to reverse some of those factors. The next slide, which shows why we're making the case across the Regional Joint Committee that this works matters, that we need to focus on it, as we said, and we heard also from Welsh Government colleague as well. NHS is the biggest employer and the biggest spender as a single organization. So we've got a very big opportunity to influence how that is done and how our own staff will behave in a way that it will promote in their communities those behaviors that will go towards improving public health, but also generating that circular economy that supports well-being. And the next slide, and do give me a nod of when we're approaching 10 minutes, because I know we're quite tight in time and we don't want to run over. So I'll focus on the column on the right-hand side of the slide, which is starting with the sustainable development and well-being economy, and moving with the use of our very progressive legislation that we've got in Wales. And I saw Marie from Future Generations office here. We've got the Future Generations Act, so making use and promoting all the capital that our act, our legislation gives us in order to support an economy that contributes to the well-being rather than the other way around. And using our institutions as anchor institutions, foundational economy, I explained, biggest employers, biggest spenders, biggest impact in population's health, and trying to work in that framework that we make measurable shifts from the money that we spent towards earlier in the pathway towards left shift is one of the jargon words trendy in the UK. I don't know if internationally, but basically prevention. And then the next slide, these are the groups that we're sort of focusing as part of the regional health economy as a subgroup of the joint committee of the boards, working with the knowledge and innovation, with the healthcare delivery, with international learning, which one of those activities is today's webinar. Thank you. And just as briefly as one example to demonstrate the complexity, but also the intention of that regional health economy is the next slide, which is the whole system approach to healthy weight. One of our biggest public health problems is overweight and obesity. We've got, particularly amongst children, we've got areas where close to every second child by age of 5 is overweight or obese, whereas amongst adults, we've got over 60% of our adult population that are overweight and obese. And as we know, obesity, overweight is not simply a matter of behavioral change of individuals, is a very systematic issue, and it's the complex system that it influences, as we talked earlier, planning, area, place, procurement, etc. So what the whole system approach, we can move to the mapping slide, so 2 slides down if you want, Carolyn. A lot of work that the team have done with all of the public services across the region and the voluntary sector and wider. And this is the map that we've come to describe how food procurement in our region looks like, and where are the parts in this map, in this journey of the food that we need to influence in order to, one, facilitate a better, healthier food, but 2, from the well-being economy, that we encourage, that we facilitate and support our own farming economy to produce our own food, which is then used, circulated, promoted, consumed by our residents. And that goes also hand in hand, as I said, with us as the biggest public sector that can influence the procurement. And then
I'm going to have to ask you to conclude, Ardiana. I'm very sorry.
Yeah,
I know that we could. It's
I'm
very
closing and very happy to move. So the slide on the long-term change, it's really trying to demonstrate that the work is aiming, and we're very clear that the purpose is for the long-term change. We're not going to change a macro system like food and a well-being economy in 1 or 3 years, but we're trying to reverse that shift, that in 10 years and in as our long-term strategy goes to 2040, that we make that meaningful change in the habits, in the behaviors, but also in the planning that we as public services and broader can do in order to support well-being economy. Thanks very much. And as we say in Welsh, diolch yn fawr. Thank you.
Thank you so much, colleagues, and thank you to Rodri, Mariana, and to you, Ardiana, for setting the scene so eloquently by, again, providing us context, but also sharing a very concrete example of how this is done and really speaking to the need to make long-term change. With that, colleagues, I'm going to go from the southwest Wales all the way to the province of Utrecht in the Netherlands. And I'm going to invite Dina Conkova, who's a senior policy researcher, to share with us how this is put into practice in Utrecht. So over to you, Dina. You are muted.
Yes.
Now we can hear you. Fantastic.
Hi everyone, and great to be part of this wonderful group. It's my first time joining you. I'm quite new to the economy of well-being, so I'm extremely happy to meet you all and listen to your great experiences and knowledge. I am a researcher at the province of Utrecht in the Netherlands, and since half a year we are very actively promoting the economy of well-being, and I have been invited to tell you a little bit about what we are doing. I had a short talk with Mariana trying to figure out what exactly should I tell you, since I'm new, and I realized that some context is necessary. So I thought, there we go. We have the region of Utrecht and the province of Utrecht, and the region is this almost 160 hectares of land in the middle of the Netherlands, very centrally situated. And it contains 26 municipalities in itself. We have a population of approximately 1.2 million, and we are considered the oldest province of the Netherlands. Some rumors say 2000 years, but officially at the province, we count back to 100 couple of years. And what characterized the province is not only that we are the smallest in hectares, but also the most densely populated. So it is very, very busy around here. There are people everywhere. It's largely urban. There are quite a few small rural areas, but compared to other regions in the Netherlands, we are a rather urban province. And the province as an institution is actually a governmental institution that sits between the national government and the municipalities. And we are actually taking the responsibilities from the national government and putting them on the municipalities. So we have a very weird position in between people who execute things and people who decide things. And in the Netherlands, all provinces are actually having their own ministers, if you wish to say, and own government. So we have 49 people who decide what we should be doing, how we should be doing it. We have 6 ministers who organize the job that has to be done. And people like me, the social servants and researchers, go to work. We are responsible for about 15 domains of life, amongst which health and safe living environment, climate change, accessibility, roads. So the province in the Netherlands are quite specifically focused on the physical environment and a bit less on the people themselves, which is quite tricky because everywhere outside live people. So the people are necessary inputs to realize the programs we have and the policy we design. But the policy we also execute has, of course, impact on the people who live in the province of Utrecht. So one of my job actually has been to pick up the economy of well-being and bring the people a little bit more back into the province of Utrecht. In the Netherlands, I think my colleague Lisbeth van Houten has once told you, but we have our own name. We call it brede welvaart. It's a very popular term, and it developed its own discourse actually boosted by Kim Putters. Kim Putters is one of the most influential Dutch researchers and politicians. For many years, he has been the director of the Netherlands Institute for Social Research, and at the moment he is the vice president of the Socio-Economic Research Advisory Board, would be the English translation. So he is on national level promoting the idea of the economy of well-being. He himself actually is a professor on the term of the economy of well-being. And we talk about people, planet, and profit. So we would like to combine everything and move forward with healthy people, healthy planet, and steady economy. Often we look at the here and now. So at this very moment, how does it look? We are very much focused on the future and the impact which happens somewhere else. So think about guest workers which are imported now from Eastern Europe, and what are the effects of this movement on the countries that are sending the guest workers. And one of the most important aspects of the economy of well-being we deal with is the distribution. So the idea that not everyone benefits equally from the goods we have in the Netherlands. And so the idea was to look at the province of Utrecht. Perhaps you're familiar with the idea, but we are a very, very faring province, one of the most faring provinces in the Netherlands, with a very good health, a very good economy, very good accessibility. All the objective indicators are actually pretty much top 1 or 2. But the idea was, what would the people think the same, and would we see indeed that distribution? And to that end, we have collected data of 1,600 residents of the region, representative for the region, and we asked them about 12 aspects of their life. So think about health, financial situation, satisfaction with the living environment, with their own homes, etc., etc. And we have also asked them about the future, what they're hopeful for, and what do they think will be a problem. And we have analyzed that data using a model that has been created in the Netherlands. We have quite a few models by now, which represent the economy of well-being, brede welvaart. And we use the 12 themes of Pon and Tellus. It's a research institution that designs it. And I would like to very briefly, it is unfortunate, but I cannot tell you everything in 10 minutes. So I've made certain choices. And all we know, what you see is that the people in the province region of Utrecht, if you wish, are quite happy with their life. On average, they rate it with a 7.4 on a scale from 1 to 10. We see some different regional differences, but I'm not going to go into those today. I'm going to take you into the highlighted aspects a little further. And one of the most interesting results, perhaps, is that if we look at all domains of life that have been rated, health and financial situation are least valued. So we're still about around 7. For physical health is 6.9 or 7, not too bad, but compared to some other aspects such as accessibility, which is above 8, they score quite low. And this is extremely surprising because, as I said, the province is actually highlighted on the fact that we have very many healthy people and a very good economy. So what we realize here is that the objective and perceived well-being is not matching on all aspects of life. For accessibility, it's matching. It's one of the best perceived and best evaluated one, but in health is not amongst. And we also have seen indeed that not everybody profits equally from the goods of the economy of well-being. And very honestly, we have expected that socioeconomic status will have a very important impact, knowing that people in poverty live 10 years shorter than people in higher income groups and so on. But we don't see that actually coming back in the satisfaction questions we have. So it's a very subjective way of evaluating whether or not you're satisfied with what you have. So here you can think of people who perhaps are not very healthy, but for the situation and the context they live in, they just gave an 8. So it's not saying much about how healthy you are, but what do you think about it? And if you think in that strain, we see that the extent to which you actually have a control over your life, a mastery, the feeling that you actually can deal with back problems, things that don't go very well, is the most important for all domains of life and for the well-being of people. And among the socioeconomic factors, we see that age is the one that plays the most role, and especially that is the case for mental health. So the youth also in the province of Utrecht, although being so successful in its well-being development, has some 20% of young people between 18 and 29 years old who are totally unhappy about their mental state. What we haven't done, and maybe we would like to do later on, is look across domains. So, for example, the accessibility would, of course, have an impact on health, but I can't tell you much about that. And a very last slide for results. We have also asked about climate change is a big topic within the province of Utrecht, and we have asked people whether they're willing and capable to adapt their homes to accommodate warmth, to save energy or go on green energy, and whether they are able to do something about water issues, and whether they're willing to buy. The last one, which is pretty close to each other, is about local food. So whether people are willing to buy local food rather than supermarket food. And what we see is that somewhere the red bars are people who would really like to do that but cannot, and the blue bars are the people who don't want to do that, and doesn't matter what follows, but they just are not inclined to go into it. And we see that some 30%, between 25 and 30% of the population actually would like to do something but cannot. And when we look into this distribution of these people, or what predicts belonging to such a group, we see that being in a private rental housing, for example, is one of the most important impacts. People living in private rental housing have up to 4 times higher chance to end up in a group which wants but cannot take measures. We see that people at young age, people with lower income, and people who have no sense of control are also more likely to end up in this group. And interestingly enough, for local food, not only the percentages are different than the other 3, you see a different pattern, but also the predictions are different. So we see that this behavioral change behaves in a different way than taking care of your own home for climate change. And a very last slide. We are a government organization doing a lot of policy. So what do we do with this research? Well, we actually do this research together with civil servants. So we ask them, what would you be interested in? What plays a role? And we communicated back the results to them, trying to actually implement the knowledge, for example, about a particular rental housing. We are looking at, can we work more with the cooperations? How can we benefit these people? How can we move them further? But we are also just taking the social servants into thinking, do we want to serve everyone? Do we want to give subsidies to the people who already can do things? Or do we want to reach the people who don't want to do and make them do things? So that's a very nice way of stimulating a discussion about what do you actually should be doing. And we have developed a serious game to support this, endeavor. And we have many more things to do. And one of them is further explore correlation with European regions. So I'm extremely happy to leave it with this, given the time, and hear more about your work. Thank you very much.
Thank you so much, Nina, for so eloquently unpacking the Brede Welfare policy. And I myself had the opportunity to see this work firsthand, and it's impressive what you have done. But also thank you for sharing with us your vision and how you intend to approach this in the future. So colleagues, we're now going to move from Utrecht in the Netherlands, and we are now going to take you to Norway, and we are very fortunate to be joined by Dina von Heimburg, who's the head of the NTNU WellFare Nordic Research Center for Wellbeing and Social Sustainability. And Dina, without further ado, I'm going to give you the floor to enlighten us on the work that you're conducting on the wellbeing economy. Over to you.
Thank you so much, Kira, and thank you all. It's a pleasure to be here. So I wonder if somebody could share my slides.
Yes, yeah, I can share your slide. Can you just remind me of the title?
Oh, yeah, it's RHN Webinar Slides, Dina.
Yes, I've got that.
Yeah, perfect.
2
Thanks.
seconds.
And in the meantime, I want to say thank you for the inspiration from Southwest Wales and Utrecht. This was really inspirational to listen to both of the talks. while getting up the slides here, I can just say that we are a Nordic research center, as Kira explained, but we are also the host of a WHO Collaborating Center on Wellbeing and Social Sustainability. And have the pleasure of working with colleagues at the Venice office, and also with colleagues like Marianne and others in Wales. So very, very pleased to be here with you. So today I will be brief on the big picture, because what I most want to do and to share is key elements within the wellbeing economy, what it could look like in practice, and how we could involve young people, and examples from Trondheim where we live. So if we got the slides up. Perhaps.
Caroline, if you can enable and put it on the slideshow, I think it will be a bit bigger.
Yes.
Try again.
Try again. I think it doesn't want to listen when it's not enabled.
That's okay. Yeah, but I can just continue, and then the slide will come up, because what I wanted to share as a backdrop for the presenting the very specific case is the Norwegian picture when it comes to the wellbeing economy. Because earlier this year, our research center published a report that was commissioned by the Norwegian Directorate of Health. Yes, thank you. So next slide, please. Yeah, there it is. So that's the report. It was commissioned by the Norwegian Directorate of Health as a part of the EU joint action on the Prevent NCDs, and we explored the scope for developing a wellbeing economy in Norway. So the starting point for this report, and also what we state here, is basically a paradox, because Norway sits near the top of international rankings when it comes to well-being, but the averages mask important differences. So you can just please, next slide. So between 24 and 28% of adults have reported low quality of life in recent years in Norway, and it's concentrated among people with low income, short education, and health problems. And younger people report lower quality of life than older people. And a part of our happiness is basically bought on ecological credit, as we state in the report, because it harms future generations' well-being, as Norway is overshooting several planetary boundaries. And the report's core diagnosis of governance in Norway, I think, travels well to any country or region, because capacity, which we have a lot of, is not the same as capability. Because in Norway, we do have the capacity. We have resources, we have laws, we have a lot of data, but what is weaker is the dynamic capability and the ability to adapt and use it all in a coordinated way. So economic growth and budget balance are currently tightly coupled to how decisions are made, while well-being, fairness, and nature, they are anchored in our values, but they are far more weakly coupled to long-term governance and priorities. And in the project, one of the informants that we interviewed from the national government put it very precisely, saying, "No one has asked us to collaborate." And overall, the report findings that rose from 65 interviewees showed how siloed hierarchical governance overshadows horizontal, systemic, and bottom-up approaches, where citizens and local and regional governments play a central role. So one of the report's clearest messages was, much of the scope for action for a well-being economy basically lies locally, in municipalities and regions, with coordinated joint action across the whole of society. Next slide, please. So what does this ask of a local government? The real question becomes, what does it ask when we can look at this, and what we can do in the local level? And for us, this is now also a live research question, and we have an ongoing PhD student now looking at this and exploring the well-being economy in local and regional levels. But it's not only a research question, it's also something that we have been working on for years and explored in practice together with citizens. So that's why I want to take you to Trondheim and to say something about what this can look like in practice. So next slide, please. So the project that I want to tell about is the citizen models in Trondheim. And first, I just want to briefly explain the theoretical lens that we use. It's mattering, the experience of feeling valued and adding value. That means being seen, respected, and cared for, and having a real role, a genuine contribution to make. And both sides are necessary, both being valued and adding value. It's close to what service often captured, and also, as we heard from Utrecht, as a sense of control over one's lives, but mattering describes also the relational side of it. So agency is not only something you have, it's something communities makes possible for each other. And the community development thinker, Cormac Russell, a UK thinker, he puts it very well, I think. He says that the twin sister to loneliness is uselessness. And we talk a great deal about loneliness, but we talk far less about having and contributing and providing each other valued social roles. And we see in Norway that is really something that we need to focus on. So mattering and well-being, it follows the social gradient. In Norwegian youth service, around 80% of boys from high economic backgrounds expect a good and happy life. Among boys from low socioeconomic backgrounds, among 40%, so much, much lower. Those with most at stake often have the least confidence that the future is for them and that they can shape it. So that's why we need to focus on social participation. So the project I want to tell about, the citizen model in Trondheim, it ran between 2020 and 2023 as a part of a national pilot on the program financing for vulnerable children, young people, aged 0 to 24 and their families. So in Trondheim, around 38 million Norwegian kroner, I think it's approximately 3.4 million euros, was used across 9 sub-projects, but the ideas were basically the same between the projects. And the money they spent was used in different ways. It was routed directly to citizens through participatory budgeting and varieties of cash transfers combined with coordinated care. And the research part of the project in Trondheim was led by us at NTNU WellFare as a developmental evaluation, where research informed both actions and assessments of outcomes. But what made this project distinctive was not really the money, it was the question. The city did not start by asking what services they should deliver. They asked, what do we need to do and promote to enhance the well-being and social participation among people in vulnerable situations in our city? And then they asked the citizens. So 2 brief examples. So one example of a sub-project was the road to the driver's license. And I want to just briefly start this case by reading a few lines from the preface of the report. It's a poem written by Ali Al-Mahabi, one of the young participants while he was in the program. And he wrote, "Not give up on me, not look down on me. We are just ghetto children who don't know better. Shall you punish me or shall you show me?" And these words, I think they explain what anti-mattering feels like from the inside. And it's exactly what the project set out to change. So through the citizens model, these young men came to feel that they mattered, and they themselves became the drivers of changing the conditions that produce anti-mattering in the first place. And in this project, 33 young men aged between 16 to 20, most of them had minority backgrounds and histories of criminal activity. They were already a part of an outreach project and program. And through this project, they were listened to, and the young men were engaged and energetic, and they were full of ideas. And what emerged from it was a co-designed program where earning a driver's license, a very specific form of dignity, practical freedom, and opportunities for work as they saw it, it was accessed through structured community participation. And what happened? Well, after 18 months, 7 young men had their license. Criminal offenses among participants had fallen by half. 22 of 33 were in work, education, or apprenticeship. And that's from the baseline. That was a massive achievement. And beyond numbers, several became peer mentors, and they were employed to support the next cohort. So they mattered, also for each other. And some became politically engaged, using their democratic voice through youth organizations, newspaper co-ops, and more, and advocating for changing the social conditions of their peers, so that they too have real opportunities to matter and flourish. So from being labeled problems to be managed to being contributors to solutions. And that is, for me, mattering in practice. And the next slide, please.
Oh,
yeah.
If I could ask you to conclude, Dina, that would be fantastic.
Yeah. Yes. The next slide is about anchor institutions. And it's an example from Brundalen, which is part of the city in Trondheim. And this example asks which institutions could carry this elsewhere. So schools and kindergartens are among the most powerful institutions that we have because they reach nearly all families during the transformative years. They are trusted and physically embedded in neighborhoods, and they have daily contact between children, families, and professionals. And in the Nordic context, they are universal, free, and with a legal equity mandate. So in the Brundalen district, Trondheim saw them as anchor institutions. The welfare agency and health authorities were physically present in kindergarten. Also, police and other actors were involved in NGOs. And together they supported over 70 families, 160 children, and they received coordinated and cross-sector support before crisis escalated, and because they helped them in the same building in a trusted environment in their daily relationships. So yeah, next, please. So I just want to conclude with that in a well-being economy, we need to make sure that people matter, that we listen, and that we enable them to have valued social roles. And I think it's important maybe also to remember like 7 I's that we have been inspired by from Isaac Piletensky, that we can remember and act on. And that's include and inquire, inform and inspire, implement and investigate and institutionalize. And that is what I think we need to do also when looking at the well-being economy in a regional context. So I can stop there. Thank you.
Dina, thank you so much. Thank you so much for transporting us all to Trondheim and speaking us through the citizen model, but also providing very concrete examples of how you're applying a well-being economy in your context. And I think this is what's been very fascinating from the 3 examples that we've seen. I can see it here in the chat as well, that it's a very active discussion, that we've seen 3 very different contexts, and it'll be interesting to see how we can sort of capitalize, so to speak, on these different ways of applying this model. And of course, the Venice office, one of the biggest things that we take pride in is to ensure that we capture all of these good practices. And with that, I'm going to briefly invite my wonderful colleague, Graham Randall, to join us to speak about the latest work that's been happening here in the Venice office on the well-being economy. So over to you, Graham.
Thank you, Kira, and welcome everybody. 3 wonderful presentations there, and 3 regions we've been working very closely with, clearly, and I can see there are other regions such as Scotland on the call. So great to see everybody here. I'll start off really from the work we've been doing since last year, just to give a bit of context around the European Wellbeing Economy Initiative work. Because last year we had a policy dialogue in Cardiff, which brought together 4 of the leading nations that are practicing wellbeing economies, and those being Finland, Iceland, Scotland, and Wales. And apologies for the omission of Norway and the Netherlands there, but those 4 countries happen to be part of a grouping called WeGo, the Wellbeing Economy Governments. And that meeting was over 2 days, and it focused on 2 themes which we're touching on here today. It talked about investment in prevention of ill health, and it talked about the links between work and health. And they're 2 themes that we have since been developing quite significantly. Earlier this year, we launched a publication called Unlocking Funding for Wellbeing, Equity and Healthy Societies, which is all about how we can access new forms of funding, because clearly there's a lot of a lot of things that we want to do and a lot of things we think we can do in these areas, but sometimes funding can be the barrier. So we launched a report in Cardiff to promote that, to promote these ideas. And that attracted interest from across Europe, well over 100 participants from over 20 countries. And we're also currently working on a follow-up to the work and health stream of activity. My colleague Heike, who's on the call today, has been producing a report on approaches to improving work and health, or the links between good work and health in the 4 countries just mentioned, so Finland, Iceland, Scotland and Wales. And hopefully that report will be out fairly soon. So those are 2 very significant strands of activity. The second one on work and health has been, we're finding a lot of interest in those linkages across Europe, not just in the countries mentioned. We're also working on a pilot project in Italy. Obviously, we're based in Venice in Italy, but our pilot project is in the northeastern region of Italy, in Friuli, Venezia Giulia, where the president of the region has established a wellbeing economy lab, where we're going to try out some different approaches, some new approaches to improving wellbeing in the region, including things which have been already piloted and in many ways applied in the UK, such as social prescribing. So that project is moving forward, and we're hoping to do a test bed of social prescribing in the northeast of Italy, which would be fantastic. And clearly, we're also working very closely with Mariana and the team, with Dina and the team, and with Lisbeth and Nina and the team in Utrecht, to support and share the work that they're doing, because sometimes it's not about us supporting the work, it's about us sharing it with other people and sharing this great practice that you're all engaged with. So I'm very pleased that Mariana has got her finger on the pulse as usual and is putting loads of interesting stuff into the chat. I'll keep it short and leave it there and take any questions if that's okay.
Thank you so much, Graham. And it is very clear that we have only just started this conversation and we underestimated the timing because we do want to, of course, open up the floor for questions. Colleagues, I'm going to have to excuse myself. I'm very sorry. We talked about the importance of climate change. I am unfortunately committed to a meeting now that will be addressing climate change, and it's been scheduled for some time. So I'm going to hand back over to my colleague Mariana, and I would like to take this opportunity to thank all the speakers for fantastic presentations, for providing very concrete examples of how to put a well-being economy into practice. But for now, I'm going to hand back over to Mariana, and thank you, Mariana, for putting together a fantastic webinar with fantastic speakers. Thank you so much, colleagues, and I look forward to continuing this conversation. And I will, of course, check in with Mariana afterwards and learn more about what comes out of this conversation. And I also want to, on that final note, also thank Alvisa, who's connected, who will be representing the team from my end. So thank you so much, colleagues. Bye-bye.
Bye, Kira. Thank you so much for your support as well. And we're at the end of our time, so there is nothing much more to say, apart from I'm really looking forward for this to be the first of a series of follow-up, webinars. There is already an RHN series, and Alvise, I'm sure, can share more around actually climate and health, which Flanders has been taking a leading role. So we're very happy actually to progress this into further, sharing and webinars, and ideally would like also to organize a study visit in Wales and welcome, a few of you to see in reality, in practice, what we're doing with some of our local health boards, with some of our local authorities as well, and also share, of course, further examples of good practice. So it's exactly 4 o'clock, and we were supposed to be 1 hour. There probably were a couple of questions, but not too many in the chat. But please do follow up. We're very happy, and I think think these webinars is one of the key things, is opening really the door for further then follow-up collaboration, exploration. I think hopefully everybody will be happy for the presentations to be shared. I know Visa will be share also the recording as well. So again, those who couldn't join because of the summer season then could listen and see as well. And yeah, looking forward to seeing you again all soon. Thanks a lot also for the colleagues from Southwest Wales. Before I forget, Sean and Sophie Marr, who couldn't join this time, but also Caroline for joining our last, and all the organizations that have supported this with. Thank you all, and have a lovely rest of the day and evening, and looking forward to be linking further on. Bye.
Thanks, Mariana.
Thank you.
Thank you all.
Bye-bye.
Thank you, Mariana.
Thank you.
Bye-bye.
Bye.
Thank you.